Oh, hi and Assalamualaikum. Today I'm going to present erythromycin ointment, which we use it on eyes. So, firstly, ophthalmic erythromycin is used to treat bacterial infection of the eyes. Then it was in the class of medication called microlide antibiotic. It was by killing bacteria that cause infection. So, type of product. Erythromycin is ophthalmic product is eye ointment. So for the generic name, we call erythromycin. For brand name, we call ERYTHROMYCIN. So these are the example of the product. So for the ingredient, each gram contains erythromycin USP 5 mg in a sterilized ophthalmic base of mineral oil and white petrolatum. Indication. For the treatment of superficial ocular infection involving the conjunctiva and cornea caused by organisms susceptible to erythromycin. So, mechanism of action is stop bacterial protein synthesis by inhibiting the transpeptidation step of protein synthesis and by inhibiting the assembly of 50S ribosomal subunit. This results in the control of various bacterial infections. So for the adverse effect, we have six, which is the first one is minor eyes irritation, stinging, burning, redness, temporary blurred vision, or hypersensitivity reaction.
Eye ointments. I get asked how to use these probably on a daily basis. And I think it's the word ointment that confuses people. So this week's video is all about how to use an eye ointment, and at the end of it, I promise you, you'll be a pro. You'll be a pro. As always, thank you for all the support, and please like, share, and tag friends who'll find this information useful. So here's my eye ointment. It's just a lubricating one which I'll be using to demonstrate with, but make sure to watch the full video because there's more to it than just applying it. First, wash your hands with warm soapy water. You're about to touch around your eye, and the last thing you want is an eye infection. Then, remove the cap, otherwise nothing will come out. Sit or stand in front of a mirror. Tilt your head back and pull your lower eyelid down using your index finger to form a pocket. And now, observe. Squeeze gently to release a thin line of ointment along the inside of the lower eyelid without touching the eye. Give the tube a little twist at the end to cut the ointment. Your ointment will be much thicker than my example, but the technique is as shown. Now close your eye for about 30 seconds to a minute, then blink a few times to spread the ointment around the inside of the eye. Amazing. Then, recap and store, and now that you know the basics, here are some important tips about eye ointments. Tip number 1. If you're using eye drops and eye ointment, first use your eye drop and then wait 5 minutes and afterwards use your eye ointment. If you do it the other way around and use your ointment first, when you put the eye drop in, it won't absorb into the eye properly and it'll just flow down your puncture. Tip number 2. If you're using more than one eye ointment, use your first one and then wait at least 30 minutes before applying your next one. Tip 3. Don't let the tip of the eye ointment touch the eye, hands or any other surfaces. This will keep it free from bacteria and any other germ. Tip 4. Eye ointments have preservatives, but they only keep for a limited amount of time once they've been opened. It's usually about 4 weeks, but always check the information leaflet for clarification. So write the date you opened it either on the box or on the tube, and don't use it after the recommended time because you're at risk of getting an eye infection. Eye ointments are thick, so when it sticks to your eye, it can cause temporary blurred vision. So make sure not to drive or operate any heavy machinery until it wears off. To reduce this, blink several times after you apply and don't rub your eyes. Tip number 6. Don't wear contact lenses whilst you're using eye ointment unless advised otherwise, because some of the ingredients and preservatives can accumulate in soft lenses and may cause damage. And that's it for this week's video. If you know anyone who uses an eye ointment or eye drops, please tag them into this video as they may find this information useful. Hey guys, thanks for watching. If you haven't already, hit that follow or subscribe button now to get more videos. Eye ointments. I get asked how to use these, probably.
And we continue for precautions label. So we have 4, which is before using erythromycin, tell your doctor or pharmacist if you are allergic to it. And the second one, before using this medication, tell your doctor or pharmacy your medical history, especially of contact lens user. It's possible that this medication will momentarily blur your eyesight after you use it. Driving, using machinery, or engaging in any other activity requiring sharp vision should be avoided until you are certain you can do safely. This drug should only be taken during pregnancy if absolutely necessary. Describe the advantage and disadvantage to your doctor. So it is for the storage, how we storage the erythromycin. Keep this medication in the container it came in, and then tightly close and out of reach of children. Store in a room temperature and do not freeze it. So for the packaging, the form is eye ointment. The packaging is collapsible tube. So this is my reference. I think that's all from me. Thank you.